Hello everyone, my name is Peter. I'm a registered nurse working on a PCU unit where we focus on mainly stroke patients. I'm just going to tell you how my day would go about on this unit. So I wake up around 5:30 in the morning, prepare myself I start driving around 6:10, 6:15. By the time I get to the parking lot at my hospital, it's around 6:30, 6:35. Walk from the parking lot to my unit takes about 10 minutes. I get to my unit around 6:45, 6:40 sometimes. I start looking up my assignments. Typically I get around 3 to 4 patients, mostly 4 patients. And then I start looking up my patient's history. I print out my patient's informations, the stuff that I will be writing down, or the patient's heart rhythm, is it sinus rhythm, AFib, whatever it is. Look at the vital signs real quick, the medical history, the patient's diagnosis, any wounds, skin issues, pretty much the head-to-toe assessment systems, the labs, especially the hemoglobin, hematocrit, potassium, sodium, stuff like that. And also if the patient's on contact isolations or droplets, airborne, I want to know about those things. Any pending activities that I have to do, such as urine collection, stool collections. So around 7 o'clock, that's when we have the huddle on our units. The huddle lasts around 5 to 10 minutes. By the time I get out, I get the report from the knock shift nurse. If I'm fast enough, by the time 7:30 hits, I should be done with getting a report. So around 7:30, I go into my patients' rooms. I do a quick vital signs on them, do a quick head-to-toe assessment, or sometimes focus assessment. And then by 8 o'clock, I should be done. 8 to 8:10, depending on if there's anything come up, like phone calls from the front desk telling me, the patient's telemetry box, the leads are not functioning, I have to go in there and fix it, or if the patient's family members call or something like that. Usually if the patient's family members call, I would tell the front desk to let them know that, call back after 10, after I'm done with the medications administration, because from 8 to 10, that's the critical time where it's all about meds giving and stuff like that. So after the head-to-toe assessment, 8:10, I try to do my EKG strips from 8:10 to 8:30, and then do my acuity of the patients. Pretty much I just have to log into the acuity program or whatever it's called. I just do the acuity real quick to see how, like from 0 to 4, 4 being the highest, well, it could go up to 5. The higher the number, the more critical the patients, the more time I need to spend with the patient. That's pretty much what it is. And then I try to do the charting, head-to-toe assessment charting, between 8:10 and 8:30. Sometimes, I don't even do the charting yet. I just go straight to med passing, And if I have blood sugar check, I try to do it between 7:45, 8, because sometimes breakfast come early, like around 8. Sometimes it come up late. It could go from 8 to 8:30. So from around 8:30 to 10 o'clock, that's the time where I pass medications. Sometimes I finish early, like around 9:30. If I finish early, I try to eat my breakfast, like a quick snack, whatever I have in my lunch bag. If not, by 10 o'clock, I should be done with the meds, passing, and then that's when I sit down, go over my patients, charting. I'm going to start looking up my patients' orders. That's the time where the doctors in the morning, where they come in the morning, putting in new orders. So from 10 to 12, that's what I will be doing, checking for new orders. Sometimes they have procedures like stress test, MRI, ultrasound, stuff like that, or procedure like cath lab. If they do have those things, I try to prepare the, what do you call those, pre-op checklists or MRI checklists. So after 12, around 12, 11:30 to 12, that's when lunch is about to come, so I have to do another blood sugar check if I have any patients with it. And then another set of vital signs, because on our floor, the registered nurses have to do all the vital signs. Every 4 hours we have to do vital signs and focus assessments. Around 12:30 to 1 to 2 actually, sometimes they have medications like Lovenox injections or antibiotics, blood pressure medications. Oh, I forgot, from 8 to 12, you're going to be receiving phone calls like constantly, almost constantly, from PTOT, doctors calling you, patients' family members calling you, CNAs calling you, the front desk calling you for, like the telemetry box not connecting to the patients. Things like that will take up your time. And then from 2 p.m. to 4 p.m., that's the time where I try to do any wound dressing changes, if I have any. Pretty much on our unit, we have the CNA round on patients every 2 hours, odd hours. So like 7 a.m., 9 a.m., 11 a.m., they would go in there, ask the patients like, do you need to use the restroom? What do you need? Like snacks or stuff like that. And then the RNs, they go in at the even hours, every 2 hours, so 8, 10, 12 to 4 p.m. So 4 p.m., that's another time where I have to do sugar check, because dinner is about 5 p.m. Sometimes they come late, sometimes they come early, so between 5 p.m. and 6 p.m. So that's the time where I do blood sugar checks, give any evening medications like antibiotics, blood pressure medications, stuff like that. And then after that, 6 p.m. to 7 p.m., I try to do any last minute stuff, wound dressing changes that haven't been done, any minor things like replacing IV. Sometimes the doctors come in late in the evening and then they start putting in new orders, so that's when you try to put in orders. Discharges and admissions, if I have 4 patients the whole shift, I don't have to worry about this. I don't have to worry about admissions. If I do have a discharge, usually it's in the evening, between anywhere from 3 p.m. to 6 p.m. If I discharge the patient around any time between that time, I will probably get an admission between 6 p.m. and 7 p.m. I know that's the time that I don't want to get any admissions, because they come up. If they come from the ER, I would have to do the patient's history, which takes a while. If they have any wounds, I have to take pictures of it, like pressure ulcers. It's not a good time to get an admission, because 7 p.m. the knock shift come. They have their huddle at 7 p.m. They come out around 7:05, 7:10, and then I give the shift report, to the knock shift, and then do any last minute charting, and then try to get out on time. Hopefully there's like no mishaps that would happen, like a fall or a patient calling for pain medications at the last minute. So that's a typical daily routine for an RN on a PCU stroke unit. Alright.